Welcome again to today's webinar on Paycheck to Paycheck, Can Workers Afford Housing? I'm going to get us started this afternoon and hopefully people will trickle in as we move forward. During today's webinar, you will learn about how to use the interactive Paycheck to Paycheck database and how the tool can inform housing advocacy efforts. My name is Janet Viveris, and I'm a research associate at the Center for Housing Policy, a research division of the National Housing Conference. I'd like to thank the Chicago Dwellings Association for sponsoring the Paycheck to Paycheck 2014 research. Any opinions or errors, however, are ours alone. The Paycheck to Paycheck tool that I'll be exploring with you today is a long-standing product of NHC and its Center for Housing Policy. NHC and the Center work in concert with NHC's members to ensure safe, decent, and affordable housing for all Americans. NHC engages in evidence-based advocacy, provides tools for effective communication, and deepens our understanding of housing issues through the research of the Center for Housing Policy. Before we begin with the heart of the webinar, I have a few more introductory notes. First, let's cover our most frequently asked question. Is this webinar being recorded? The answer is yes. An archived copy of this webinar will be made available in the coming days. I will send a link out to everyone who registered once the recording is online. And we strive to provide these resources within 48 hours of the webinar ending, barring any technical difficulties. Second, please note that all participant lines are muted in order to ensure clear sound quality for everyone. However, I will be taking questions at the end of the webinar. If you have a question at any time during the webinar, please submit it through the question box in the GoToWebinar control panel that's outlined here in red. I will answer as many of your questions as possible at the end of the webinar. And finally, let's address technical difficulties. While I hope the webinar runs smoothly for everyone, sometimes this just doesn't happen. If you run into any technical difficulties during the webinar, please use the Help menu at the top of your GoToWebinar control panel to locate technical support. If that doesn't work, please visit the GoToWebinar support website with the link provided here. All right, now moving on to the webinar. Housing affordability for workers, where do we start? When thinking and talking about housing affordability, there's many different ways to determine what is affordable housing. One of the common ways for determining the affordability of rental housing is to look at the minimum wage of workers and determine whether their income is sufficient to afford rent in their area. Thinking about housing affordability from a home buying standpoint, oftentimes analyses compare the area median income for all workers to median home prices. And these methods are certainly useful tools for gauging overall affordability, but they don't always get at how affordability is different depending on income and occupation. One of the strengths of Paycheck to Paycheck is it's a flexible approach to thinking about housing affordability. The tool includes wages of real workers in a variety of industries, and it compares these real wages to what actually is required to afford rent in an area, or how much income is needed to afford to buy a home. The first question to think about is, what is this tool, Paycheck to Paycheck? What it is, and what I'll be showing you a little bit later on in the webinar, is an interactive online database. It contains data on, as I mentioned, wages as well as housing costs. And it returns these graphs. I have a sample up on the slide here that shows you not only what the median home price is, either nationally or within a given metro area, but also the annual income a worker would need to actually be able to afford that home price. And that's represented in the light blue bar on the left side of the graph. To the right, what you see are the actual incomes of a variety of different workers in an area. And you can see if a worker's income falls short and get an idea of how far it falls short of what's needed to actually buy and own a home in the area where they live. So coming back to this idea of housing data, what Paycheck to Paycheck does is it includes housing data in terms of home prices and rents for 210 core-based statistical areas across the U.S. that we refer to as metro areas. This covers 48 states plus the District of Columbia. You can see there's numerous metro areas covered in states like California, Florida, Michigan, Ohio, and Texas. However, we don't have data for two states, Montana and Wyoming. We'd love to add them, but currently data limitations prevent us from doing so. Now I want to ask all of you to give me some input before we move further in the webinar. When I demonstrate the tool, I'll be looking up data for a variety of metro areas. So what I'd like is for you to give me your suggestions for what metro area you would like to look at today using the question module in your toolbox. And please feel free to enter that at any time. I'm already seeing some great suggestions rolling in. Thank you. Now thinking about wages, what kind of wage data does Paycheck to Paycheck have? The online toolkit includes median metro-based salaries for workers in 80 different occupations, and they're all listed on this page. So they range from accountants to welders, with a variety of workers in between. The salary data comes from salary.com, and it's representative of workers in these listed occupations with a few years of experience, generally about a step up from entry level for their role. I'm going to ask for your feedback again, and now I want you to think about what kinds of workers do you want me to take a look at later in this webinar. And take a look at this list and feel free to enter your recommendations as I continue. How do we calculate affordability in Paycheck to Paycheck? Well, the first thing that we look at when we're considering whether home buying is affordable is we assume that a home would be affordable if a worker is spending 20% or less of their income on their monthly housing costs, and this is in line with typical underwriting standards for home buying. But we also employ several other assumptions, which I have outlined on the slide. The first is we assume a 30-year fixed-rate mortgage. We also assume the worker is able to make a 10% down payment. And we want to include other associated housing costs with home ownership. So we use an average effective interest rate from the Federal Housing Finance Agency for the first quarter of 2014 in this year's release. We also use estimates for private mortgage insurance and property taxes and insurance. What about for renters? How do we calculate affordability for them? Well, when looking at renting, we assume that rent is affordable if it doesn't constitute more than 30% of a worker's income. And the actual rents themselves, we take from HUD's fair market rents for one-bedroom and two-bedroom units. These typically represent rents at the 40th percentile in a metro area, although in some cases it does represent rents at the median in a metro area. So now we're actually going to demonstrate Paycheck to Paycheck. And if you'd like to follow along on your own, you can use the link that I have listed here. So if you follow this link, you should be looking at the same web page that I'm looking at that contains a great deal of data on Paycheck to Paycheck in our database. We start up at the top of the page with some context for the tool and why housing affordability is an important thing to consider. We talk about the data that's included in the tool, which I've outlined already. And then we have several other materials, including infographics for healthcare workers and community workers, our report, which provides our analysis of health sector workers, Each release, we highlight workers in a different industry to shine a light on their particular housing challenges. And then below, we have a variety of fact sheets, which rank rental markets and homeownership markets according to their costs, as well as the change in incomes needed to rent a home or buy a home. And then if you continue to scroll down, you find the actual tool itself. Now, I'm going to bring back your suggestions for the metro areas to take a look at today. So we had a lot of great suggestions spanning the country. Now I'm going to go with Nashville, Tennessee, and that was submitted by Terry. Thank you, Terry. So you can start off by selecting your metropolitan area from a list of all the 210 metro areas that we have in the toolkit. You scroll down to Nashville, and then you have several options here. The first is to view 5 healthcare occupations. Now these occupations are the ones that we have decided to highlight in our annual report. Then your next choice is 5 community worker occupations. Now these represent elementary school teachers, police officers, nurses, retail salespeople, and janitors, workers that most communities really rely on. And then your next option is to customize, which is what we're going to do. Now I'm going to take another look at all of your great suggestions to get some ideas for occupations to look at today. So we have a vote for firefighter, urban planner, home health aide. Let's see here. You scroll down and you look for your workers. Home health aide, urban planner, and we'll select 2 more. I see retail salesperson as well as teacher. Now the challenge is also knowing where to look. Okay, so you have a chance yet again to select 5 healthcare workers or 5 community workers in case you've changed your mind. But we're going to go ahead with our selection here and display the graphs. The first thing you're going to see is the graph that represents the affordability of home ownership in the market. Now you can see we're looking at Nashville, Tennessee metro area, and you'll see the median home price for this metro area. This light blue bar on the left represents how much income a worker would need to afford to buy a median home of $168,000 in this metro area using the assumptions that I talked about before. So in this case, a worker would need to earn a little bit over $46,000 a year. Now when you look to the right, the picture is not very positive. We see that there's only 1 worker of the 5 that we highlighted, elementary school teachers, that have median incomes that generally put them above what they would need to afford to buy a home. And you also get a sense of how far some of these workers fall short of this goal. So for home health aides and retail salespeople, they might have to earn up to or more than double in order to afford a home. Down below, you're going to see some text that talks about the data that's included in this graph. And then if you keep scrolling down, you're going to see a graph that represents the rental market. Now here we include data on what the rental costs are for a 1-bedroom apartment in Nashville and a 2-bedroom apartment in Nashville. And that's represented by these 2 light blue bars to the left. Now if you look first at a 1-bedroom apartment, typically what you would assume to be a very affordable housing unit in area, you'll see that home health aides and retail salespersons are still falling short of the income they would need to affordably rent. And they don't even come close to what you would need to afford a 2-bedroom apartment, which becomes a particular challenge if these workers are trying to support a family and looking for housing for them. Now you do see some positive information, which is renting either a 1-bedroom or 2-bedroom is a little bit more affordable for a firefighter or an urban planner than considering home buying. Now there's another option that you can use when putting together a graph, and that's by starting with the occupation. So here we're going to scroll down and take a look at firefighter. But we're going to look across several different metro areas. So I'm going to pull up your suggestions again and see what other places to look at. So I see a suggestion for Minneapolis, Chicago, and Houston. And so we're going to customize our metro selection again. Okay. So scrolling down to Chicago, Minneapolis, and Houston. And again, you have an option to use a pre-selected setting, which offers you 3 metro areas. In this year's release, we include nationwide data, data from Chicago, and data from Los Angeles. But we're going to proceed with our selections today. Now, these graphs look a little bit different because we're just looking at one occupation. But you start again with the home ownership market. And in each metro area, you're offered the median home price. So you can get an idea of how home prices differ across these markets. And the light blue bar again represents the income needed to purchase a home in the metro area, and the dark blue represents the actual median salary for workers in this occupation. And you can see that in these 3 metro areas, firefighters are falling short in terms of salary and what they would need to actually afford to buy a typical home in this area, which is concerning when you think about how much every community relies on their firefighters. Now let's take a look to see if renting is more affordable. In this graph, you're going to see the fair market rents for a 1-bedroom and a 2-bedroom apartment for the 3 metro areas. The lightest bar represents the income the workers would need to afford a 1-bedroom. The medium blue represents a 2-bedroom, and the dark blue represents their actual salary. So this is a little bit more encouraging. We can see that firefighters typically earn enough to affordably rent both a 1-bedroom and a 2-bedroom apartment in these 3 metro areas. So let's switch gears a little bit and come back to our webinar here. So this gives you a quick overview of how to use the tool. Now, a lot of you have probably noticed that while 210 is a large number of metro areas, it doesn't cover everywhere and everyone. The good news is you can complete your own local analysis of housing affordability using a similar methodology that we used in our toolkit. What you would want to do is collect local or county level data on home purchase prices and rents along with wage data. And then you can compare the wages to what incomes would be needed to affordably buy or rent. You can follow detailed instructions on how to carry out this analysis on our website using this URL right here. Now, what's the next step? How can you use paycheck to paycheck in these graphs? Well, the first step is to actually use the tool to select the areas you're interested in or the workers you're interested in and download and share the graphs that are generated. What this can help you do is create a tool for advocates in your area to frame some of the housing affordability challenges. Oftentimes, members of a community don't realize that even people who work full-time cannot afford common housing in their area. It's often assumed that community workers like firefighters earn a sufficient amount to buy a home in their area, but as we saw, that's often not the case. It can also be a tool to pitch housing affordability stories to the media because it shows very clearly that there's a need for more affordable housing in a community, and it highlights some of the challenges that workers face. It can also be a tool for demonstrating the need to continue funding for existing affordable housing initiatives. Oftentimes, understanding that the problem hasn't been solved can help compel people to continue work to address a problem like housing affordability. It can also start as an inspiration for local research and other research that can be conducted to really understand what housing affordability challenges exist in your area. And now for some communities, particularly housing markets that haven't recovered yet, it often looks like housing is affordable to workers across the board, and often this can be the case, but it can be a good story for why it's important to keep housing affordable and how it can be a draw to local industry and create jobs. Now, I'm going to transition into how the center has used the data from Paycheck to Paycheck this year. As I mentioned earlier, every year we release a report that contains an analysis of workers in a particular industry to highlight some of their unique housing challenges. Now, this year we highlighted 5 health workers, which you can check as a pre-selected option in our toolkit. The workers we highlighted this year often indirectly or directly serve patients of all kinds, but in particular older adults who are trying to age in place. And the need for these kinds of workers is great already, but is expected to grow dramatically as the older adult population grows in the future. These 5 jobs all have high projected growth rates over the next 10 years. But despite the health of their sector, many of them are struggling with affordability challenges when it comes to housing. The graph that you see on this slide comes from our report, and what it shows is the number of metro areas that are affordable to these workers across the total 210 metro areas. The light blue represents the affordability of renting, and the red represents buying. Now you can see off the bat that lower income health workers like medical records transcriptionists, medical billing clerks, and home health aides face some severe housing affordability challenges. For medical record transcriptionists and medical billing clerks, less than half of the metro areas that we looked at are unaffordable when it comes to buying a home. Renting is more affordable for these workers, but there are still over 40 metro areas that are too costly for medical record transcriptionists and medical billing clerks. And in the case of home health aides, there's only 1 metro area where they can afford to rent, and that's in Mansfield, Ohio. If you look a little bit further down in this graph, you'll see that geriatric nurses and case managers who have higher and more moderate median incomes of about $60,000 nationally face fewer metro areas where housing is unaffordable to them. But there's still a gap between the number of metro areas that we looked at and the number where they can afford to buy a home. There's over 40 metro areas where prices are just out of reach for geriatric nurses and case managers, and a handful of expensive metro areas on the coast where they cannot afford to rent a 2-bedroom home. On this next slide, you'll see a chart that we've put together that highlights affordability for these workers in the 5 metro areas in our Paycheck tool with the highest concentrations of older adults. Looking left to right, you can see again that these lower income workers, home health aides, medical billing clerks, and medical record transcriptionists often are priced out of these metro areas where demand for their services is very high and expected to continue to grow. Now, if you look to the right, you'll see that these metro areas are affordable to moderate income case managers and geriatric nurses, which is the good news. But when you look to the left, you'll see workers who are going to be faced with difficult decisions when it comes to finding housing they can afford. This often means that they have to live far from their jobs and face expensive and long commutes, or it could mean that their households decide to live closer to their jobs but have to make cuts in other important parts of the household budget like food, childcare, and transportation. But the challenges don't just stack up for households, but it also exists for communities when housing isn't affordable to health workers. In many places across the country, there are regions where there are severe shortages in health workers that limit healthcare access to patients in the area because there isn't enough manpower to meet the need. Now, when a metro area is unaffordable to numbers of health workers, this could potentially worsen healthcare worker shortages as workers look for other metro areas where housing is more affordable to them. So there are potential negative impacts not just for the workers themselves, but also the communities that rely on them. Now I'd like to move on and address some of the questions that you have either about the toolkit or any questions that you may have about some of the findings I highlighted from this year's analysis. Okay, so we have a question that came in asking, how fair is it to make some of the statements based on single income? I'm in full agreement that there are issues, but assuming most families can do things on one salary is not likely or accurate. Now that's a fair point. We are assuming that these are one-worker households. And now there are many households where there are 2 or 3, possibly even 4-worker households. There's also a large number of households in the U.S. that are single income, either because it's a single person or a single parent, or it could be that in the household there's only one able-bodied person able to work, or only one person who's currently employed. So while these challenges don't apply to all workers in these occupations, they are common for many workers. We have another question that came in. Is renting really that difficult for home health aides versus buying? Now that is a very good question and one that certainly came up when we conducted our analysis. And what we found is that very interesting anomaly where more metro areas were affordable for home buying than renting for our home health aides was that in some of the very low-cost metro areas where home buying was affordable, there's often a limited supply of rental housing and a great demand for that rental housing that can drive those prices up while home prices for buying stay relatively low. So it'll be interesting to see how that dynamic shifts as many low-cost metro areas and their housing markets rebound as we move further from the housing crisis. Okay. So it says, when I try to change the pre-selected areas or change the 5 community worker selections, the results always show the default selections. That is going to be the case. If you use the pre-selected areas or pre-selected workers, it will always return those 5 workers or those 3 metro areas. So what you want to do when you use the tool is actually select your metro area and then customize the workers, or select your worker and customize the metro areas. Okay. We have a question that came in. It says, for homeowners, can you share how you came to a 28% home cost income ratio? Can the tool vary this assumption? So that is a number that we came up when we surveyed typical underwriting standards. So while we're making generalizations about what a household is facing in terms of housing costs and things like that, we wanted to try and make it somewhat realistic in thinking about what an underwriter is looking at when they're determining whether a household can afford a home. And we found that 28 was a common underwriting standard. Although if you have some information on how this has changed, I would be very happy if you could share it with me. The next question that came in from the same person is, can the tool vary this assumption? And unfortunately, it cannot. However, for next year, we can certainly adjust that to make sure it's more in line with what the standard is today. Or if you want, you can adjust that in your own analysis. As I mentioned earlier in the presentation, there is a link to completing an analysis with the same methodology. So you can collect some of the same information. A lot of it is public. We obtained our home price data from the Public National Association of Home Builders, National Association of Realtors data, and we obtained the rents from HUD's Fair Market Rents, which is also public. However, the salary data we did purchase from salary.com, so you would either have to purchase that data yourself or use some other public salary data that you have available. Okay. The next question that came in is, can you use the tool for an income level that isn't one of the listed job categories, such as someone living on Social Security? Now, that's not something that we have included in the toolkit as of yet. However, that is a really great suggestion that I'm going to make a note of that we can look into including in the future. As I mentioned before, if you want to, you can also recreate this analysis on your own and use that yourself. So you could determine what the Social Security income for an individual might be on average in a metro area, and then use some of these public sources of housing cost data to determine how often you're going to find people falling short of what's needed to afford the housing. We also have a statement that came in: with a growing trend of urban migration, we will see more gentrification as housing affordability becomes out of reach for many workers. That's an excellent point, and something that we certainly want to keep an eye on is how housing affordability is changing over time. So we have another question that came in about the difference in the number of metro areas where a home health aide can afford to buy a home versus rent a home. So it is in fact the case that home health workers, according to our analysis, can afford to buy a median-priced home in more metro areas than they can rent. And this is an unexpected finding that we came across. But when we did look into it, we found that this difference really plays out in the very low housing cost markets, where the rental market is constrained enough to keep prices relatively high, but the home buying market has not recovered. We also have a final question that came in. Will you ever be adding utility costs or transportation costs to the affordability mix? Which is a great question. Certainly something for us to think about, utility costs. We'll take some time to try and come up with some relatively accurate estimates by metro area. But in terms of transportation costs, there are actually some existing useful tools for thinking about housing and transportation together. HUD actually released recently, a few months ago, a housing and transportation cost index that I would recommend you take a look at. It gives you a really good picture of relative costs when you move further away from job centers. So it looks like that is all the questions for today. However, as you can see, I have included my email address on this slide. So if you have a question that pops in your head later today or at some future point, I'd love to hear from you. Thank you very much. And as I mentioned before, in the next day or so, I will be sending out an email with a link to this archived webinar that you can share with friends and colleagues that weren't able to make it. Or if you want to go back and view parts of it, you can do that as well. Thank you so much for joining me today.